In this video, we will review what patient assessment findings you may see in each of the four classes of circulatory shock. Shock of any type is defined as a clinical syndrome characterized by inadequate tissue perfusion that results in end organ dysfunction. That being said, all four classes of circulatory shock share four common symptoms. These are tachycardia, tachypnea, low blood pressure, and an altered mental status. When any type of shock is suspected, it is very important to rule out any other possible diagnosis. You need to make sure you are treating the right disease process and caring for your patient appropriately. That being said, each class of circulatory shock presents itself differently. If someone has cardiogenic shock, they will have cyanosis, cool extremities, irregular peripheral pulses, jugular venous distension, peripheral edema, and crackles on auscultation. Most of the time, cardiogenic shock has to be treated with a surgery called a CABG. This picture is illustrating what happens in that surgery. In box A, it shows you the location of the heart, and in box B, it explains that they take a vein graft from your leg and they stitch it in place of the blocked artery. If someone has distributive shock, they will have trouble maintaining their body temperature, oxygenating, and they will have a decreased urine output. Someone with septic shock will have symptoms correlating with a bad infection. Things like fever, chills, dyspnea, anxiety, fatigue, nausea, and vomiting. Lastly, if a patient has obstructive shock, they will have increased jugular venous pressure, pulsus paradoxus, chest pressure, dysphoria, and cold, clammy extremities. Make sure to watch your patients closely for any changes in their vital signs that indicate shock.